there's a saying, or I'm sure you've heard this saying, and I might get it wrong, so forgive me, but there's that saying that says, those that can do, those that can't teach. So that might be an okay saying, and that might be fine and well, but guess what? The faculty members at University of Houston College of Pharmacy, not only do, they teach too. So our faculty, they can do both. And so the next person I'm about to introduce is none other than a wonderful faculty member that does and teaches as well. So um, I wanted to have a speaker tell you a little bit about their role in terms of what it's like to be a faculty member here, but also what her pathway was to the College of Pharmacy, to the profession, and then just that day to day, like expectations from a faculty member, expectations as a professional. And so it's really good to hear from someone who's already there, because obviously none of you all would be here today if you weren't trying to get there too. And so that's why we have a wonderful faculty speaker spotlight feature. So without further ado, I am introducing Dr. Onye Ohang. Oh, I'm sorry if I say it incorrectly, Ohanobu. And she's going to talk about her role in the College of Pharmacy and then all the wonderful talent and experience that she brings to the College of Pharmacy. So I am so sorry I said your name incorrectly.
It's okay. It's okay. We're still here. We're okay.
Okay.
All right. Can I share my screen? I'm pretty visual, so I just put up a couple slides for you guys to follow along with me as I speak. So I'll go ahead and share that now. All right. Can you see the screen there?
Yes, we see it.
All right, let me go ahead and put the slideshow and let me know if you see okay. Do you see the presenter's view or the regular view?
We see your presenter view. So we see your screen and then you're talking. Yes, we see you as well.
It looks perfect.
Okay, perfect. Okay. All right. Really excited to be here. I remember when I was a pre-pharmacy student and I didn't know what to do, where to go. And so I'm really excited and grateful for University of Houston that they're so passionate about speaking to you all, especially on this day. So without further ado, I'll go ahead and start. So this talk is going to be pretty much about my career path and pretty much how I got here, and then also maybe some tools for you guys to have, to kind of learn more about pharmacy as well. All right, so we're going to start off. So I started out at the University of Connecticut. Very, very, I know I'm here at U of H, but I'm a Husky at heart. So basketball, March Madness just finished, and so we didn't go too far for the men, but the women did a great job. They lost, but I'm very, very, very proud of University of Connecticut. But I started there and got a bachelor's of allied health and diagnostic sciences when I was there. I really, really enjoyed undergraduate. I knew from the beginning that I wanted to be a pharmacist. So that's something a little bit different about me. So as a senior in high school, I did a pre-pharmacy there was an informational my brother went to, and I went with him, and I was like, yeah, this is where I'm going to be. So I kind of knew already in the beginning that I wanted to be a pharmacist. And so as I went to the University of Connecticut, I had that in mind. So I did a little bit of research there, like a student research with some professors there, just to kind of get my feet wet in there. And then what's unfortunate is I applied to pharmacy school, and guess what? I didn't get in. So not a lot of people know that, but I didn't get in at all. I applied to 14 pharmacy schools and I did not get in. And so I took a year off and I worked at a health clinic called Cornell Scott Hill Health Center. And what I did there, I was a drug treatment advocate. And so my role was to help HIV patients, not HIV patients, injection drug users, facilitate them into a rehab type center to help them be clean. And then that prevents HIV risky behavior. So it was an HIV clinic that I worked in. And that was the moment where I said, you know what, now I found my purpose. So now when I apply to pharmacy school again, I know that I want to focus on HIV. The clinic was amazing. And in my mind, I just kept saying, what they need here is a pharmacist. So I applied to pharmacy school again, and I got into many schools this time. Now I had a new application. I was well-rounded, and I decided to go to the University of the Incarnate Word in San Antonio. While I was there, I also got involved. I was one of those students that was very I was excited to be there. I mean, I knew I wanted to do this, right? So I got involved. I got involved in pharmacy organizations. I had, I did HIV related projects. And, you know, I really knew like that I'm going to be a specialist. So the next step after pharmacy school usually is a job, or you can do a residency. And nowadays there's so many things you can do. You can do a fellowship. So I decided to go ahead and do a residency. So I did my residency at Howard University Hospital, where I kind of learned more hands-on training as a pharmacist. And so I did that training 1 year in a hospital. And then after that, I went on to go get a job at MedStar Washington Hospital Center. And that's where I kind of started getting more into what my specialty is now. So as I'm talking to you guys, I'm telling you guys, I really was interested in HIV. I thought that was going to be my pathway. But once I got to my residency, everything changed. I did one rotation in cancer medication. Oncology is what we call it. And I just fell in love. So I pivoted that way. So that's another thought, that you don't always have to have everything set that you want to do. I mean, things change, but it's good to kind of have, you know, keep your mind open and options open as well. Then in 2016, I transitioned from Washington, D.C. to Houston. My husband was here, I got married. And so we decided to move here. So around that same time, I started a nonprofit organization called Pharmacy Initiative Leaders. We'll get into more of it later on in the presentation, but it's a nonprofit organization that really seeks to help students, pharmacy students, kind of land their post-doc training. So residencies or fellowships. We do like CV review, mock interviewing, case review. And so it was an organization that stemmed from, you know, me and the other 3 founders not really having guidance on our way. I also then started working again in inpatient oncology. And then I did that for a couple of years from 2016 to now. And so not too long ago in February 2021, I started my role here at the University of Houston as a research professor. And so my research focus is in health disparities in oncology patients or hematology patients. And so I still do have a clinical practice. So when a lot of people hear research, they think of the lab, and that's also a part of research, but my research is a little bit unique. My research is in my clinic, my practice site. So I see patients, and my research questions come from me being in the clinic. So it's a very interesting role there, but I really love it. So what is a hematology oncology clinical pharmacist? Like, what do we do as a, you know, in this realm? So as a pharmacist in the hospital setting, my role is to make sure that I'm kind of bridging the gap for our patients, as well as the healthcare practitioners, the physicians. I get involved with treatment dosing, making sure that our patients that have are getting chemo, are getting the right medication, the right dosing. We are pharmacists, so we are the drug experts. So the physicians look to us to make sure that we are helping with, you know, drug information questions or things that they may not know on the medication side. I don't know if a lot of you all know this, but in medical school, a lot of them have like 1 semester or 2 semesters of pharmacology, whereas pharmacy school, we have entire 4 years of pharmacology. So we know, we're the experts in medication. I'm also responsible for making sure and ensuring safety through medication and symptom management. So if our patients are having some type of issues, maybe high blood pressure or maybe a rash or something, we can kind of comb and figure out what's going on. Like, is it this medication? Is it, you know, the dose? Is the patient's kidney working well? You know, a lot of medications go through the kidney. So that's what that's what I do kind of on a day-to-day, just kind of making sure that all the patients are okay. Now on the academia side, I also teach. So as Nikisa was saying, I also teach in the oncology module or in the oncology class. And so I teach different types of cancers to the students. And I'm also doing research year round. So I'm conducting research in my research areas and my research focus areas, which is health disparities. I'm very interested in leukemias and sickle cell. So that's, you know, what a day-to-day kind of looks like for a clinical pharmacist and in academia. We're also team collaborators. So just because we're a pharmacist doesn't mean that, oh, we just, stick to the pharmacy department. We work with physicians, nurses, social workers, case managers, and you just have to be able to build that rapport with the team. I mean, that's very important when it comes to our profession. It's not only just, siloed in just as pharmacists hanging out with pharmacists. So we have a lot of team members that we work with, and they really do look to us for drug information questions. Another part of my role is also mentorship. So I mentor students and residents. Mentorship also looks, we also call it preceptorship. And so when a student comes with me on rotation at my practice site in the hospital, I'm helping them learn about the different cancers and disease states. And so it's really, I really love doing that, because I feel like when I was a student, I loved my professors that really poured into me as well. And then going back to the Pharmacy Initiative Leaders I was telling you guys about earlier, my nonprofit organization, this organization is super important to me. It's something that I'm very passionate about. I truly believe in diversity in the healthcare field. That's because there's a lot of patients that are out there that, need that diverse touch. If you've never been in the shoes of one of your patients, how will you be able to take care of that patient? For example, sickle cell patients have a lot of pain because of the disease state and what happens, through that process. Now, if you've never had sickle cell and you don't know what that pain feels like, how would you be able to take care of that patient? Or if you've never learned about the patients or kind of sat down and interviewed a patient, how would you know? And so that's something that I'm very passionate about. I would like to spread that diversity. And that's what we're trying to do through Pharmacy Initiative Leader. We're starting with pharmacy school, but eventually the plan is to branch off and just kind of, allow other healthcare professionals to kind of, use us as a resource to kind of educate on that. As I talked about before, my research interests have to do in health disparities, and that is in 4 domains. So patient safety and effectiveness, gaps in care, like patients that may not have access to care or may not have insurance, but they need help, or they may not have a car and can't get to their appointments. So those are some of the areas that I'm interested in. Quality improvement. For example, if you come to the hospital and patient needs chemotherapy, but the patient gets to the hospital at 8 a.m., but they don't get their chemo until 9 p.m., that's not good, right? So they've just been sitting in the hospital for almost 12 hours. So I'm interested in quality improvement and kind of process improvement as well. And then, of course, as I just spoke about with my nonprofit, increase diversity and inclusion. Some of my research projects over the years, starting even from undergrad, was medication adherence in HIV injection drug users, health literacy and readability. So in San Antonio, when I was in pharmacy school, the reading level was 6th grade. So the reading level is 6th grade, but all the patient discharge pamphlets are college level reading. How are the patients supposed to understand, how to go home and take their medication if they can't even read the pamphlet? So I did some research on that. Medication reconciliation. So when I was a resident, one of my major projects was to make sure that when patients come into the hospital through the ER or are admitted outside of the ER, there should be a pharmacist or a nurse or a physician or someone that goes through the patient's medication list to make sure that when they get into the hospital, they're starting, critical medications like high blood pressure medications, and not starting the non-critical, like maybe a vitamin or something. We don't necessarily need that for acute or for, immediate issues. So that was another project there. Quality improvement, as I talked about, the chemotherapy delays, and then medication adherence in oral anti-cancer therapy. So we're looking at breast cancer patients and looking at if they're taking their medication appropriately. There's a lot of delays or non-adherence, not taking the medications. There could be so many different barriers. It could be maybe the lack of education, or sometimes, these patients don't feel any pain, they don't feel any issues. They're like, well, why should I take this medication every day if I feel fine? So just education on the importance of it. Maybe there's some side effects. Maybe the patients are feeling hot flashes or something, and they just like, I don't want to take this medication anymore. So we're doing research on that as well. The similarities with all of these projects, once again, is the health disparities. So that's my research interest, and those are some of the projects I've done over the years. some of the current research I'm working on is looking at the microbiome, which is bacteria in your stomach, in the gut, and see what effects it has on pain crisis and sickle cell patients. I'm also looking into the high dose AML therapy and what are the outcomes of our patients here at the county hospital. What does literature say is a good response rate to some of this chemotherapy versus what our patients at the low income patients or indigent patients, underrepresented patients experience versus what the literature says, which are not in those patient populations. And then medication adherence in multiple myeloma patients taking immunomodulators. So once again, it's just medication adherence. Are they taking the medication the right way? And then lastly, this is a book that I read as a pre-pharmacy student. It was the most amazing book I've ever, I think it's what solidified me that like, I'm definitely going to be a pharmacist, because all I ever knew about pharmacy was retail, like Walgreens, CVS. I didn't even really know too much about the hospital. I didn't know too much about industry, like working for big pharma companies. But outside of those three, even academia, outside of all these things, there's so many different areas. There's tech. I have colleagues that work with Google in healthcare. I have friends that work in companies that are doing artificial intelligence, because anywhere there's medication or anywhere there's any type of pharmacy related anything, we can do it. So for example, I have a friend that works in marketing. Who is better to market a drug than pharmacists? We know what drugs, we know how drugs should be marketed. I have friends that work on Wall Street, and people say, Wall Street, I don't get it. There's pharmaceutical companies there's pharmacists that have interest in finance, and there's pharmaceutical companies that have businesses that are on Wall Street. So who better to do that than a pharmacist who has an interest in finance? So there's so many different ways that I have friends that work in tech doing content creation. Who better to do content creation for a pharmacy drug than a pharmacist? So I think as we progress in the future, our minds are starting to open up more. There's more than just retail. There's more than just industry. There's more than just academia. There's so many different areas for pharmacists, which is why I'm so passionate about our profession. But if you need to screenshot this page, please do that. This book is actually free. It's online as a PDF. So please go ahead and do that. It may be a little outdated because once again, I'm not going to tell you how many years I'm removed from undergrad, but it was new then, but I think it's still very relevant. And I think I just hit the mark.